My name is Zoe Clark. I'm Senior Self-Management Programme Officer here at NASS. And I'm hoping my voice is going to hold out for the whole session. But I'm delighted to be joined by Claire Jeffries. Hi Claire, thank you for joining us.
Hi Zoe, thanks for having me. Hello everybody. Really delighted to be joining you for this first session of Facebook Live 2023. It's my first one, so bear with me. Hopefully it'll be a good one. And yeah, really delighted to be here. So thanks for having me.
You're welcome. And before we get started, do you want to introduce yourself and let everyone know what you do?
Yeah, absolutely. So my name's Claire Jeffries. As you said, I'm a physioclinical specialist. I work in hydrotherapy and rheumatology. I'm employed by Solent NHS Trust and work on the sunny south coast in Portsmouth. As part of my role, I'm actually seconded into Portsmouth Hospitals University Trust, the acute trust, and I work with an amazing team there and with our amazing AS population of patients in that district. I do annual review clinics for the AS patients, so those that are not on biologics, and then also do the screening and review appointments for the biologic patients. So working with 7 consultants, I think, in our rheumatology department. And then obviously with my other physio hat on, I'm also a hydrotherapy manager and work with patients in the hydrotherapy pool as well. So a bit varied. I'm chairman of AStretch, so it's a national group of physios who all work with Axial SpA. We try and promote the management of and support the management of AS patients across the country, really. And obviously, Zoe, as you know, I'm also the pleasure of being a trustee for NASS and also part of the medical advisory board, so which is an absolute delight. So yeah, it's a great honour to be able to work with patients with AS.
Thank you, and I know you're super busy, so we really appreciate your time today, and always appreciate your expertise on our projects as well. So thank you.
Thank you.
And we've got a few people joining us live. So hi to Scott from Northamptonshire, Helen from North Yorkshire, and Liz from Billingham in Teesside. So we've got a whole range of people joining us today, and I'm over on the East Coast in Suffolk as well. So covering the whole UK, I think.
Brilliant.
That's brilliant. So if you haven't seen one of these sessions before, what we're going to be doing is we'll have a chat to begin with to introduce the topic. And then Claire's going to be doing a presentation all about mobility aids in Axial SpA. And we'll have time at the end for questions. So if you have any questions for Claire through the whole session, then please do pop them in the comments and we'll cover as many as we can at the end. And if you can't join the whole session live, then don't worry, because you can come check back in later and the video will stay on our Facebook page. And we'll also upload it onto our YouTube page as well, so you can catch up anytime. So if you have any questions but can't stay for the whole thing, please do pop them in the comments and we'll make sure we cover them. Brilliant. So I think a good starting place really would be to talk about kind of what mobility aids are and how different things can be helpful. So do you want to tell us kind of in a nutshell, Claire, kind of what mobility aids are?
Yeah, I mean, so mobility aids, we use them across all disciplines, as I'm sure you all know, and there's such a variety of mobility aids out on private market as well, and we're going to be talking about that a bit later. But we use mobility aids really to try and keep people functional. We use them if you've got loss of lower limb muscle strength or reduced range of movement, or you've got reduced balance. We can use them for a variety of reasons, really, as I say, just to try and keep you independent and keep you functional. I think as a physiotherapist, Zoe, I really want to minimize how much mobility aid somebody might use if they don't need it, because we want your body to do what it's meant to do. We want your muscles to work and be strong. We want your joints to work. We want you to have good balance. So there is a real fine line, and I know we're going to talk about that, about when to use a mobility aid and when not to, and what type of mobility aid to use. So we're hoping that we can cover some of that today for everybody.
Absolutely, that's great, thank you. And I've just spotted as well, we've got JC joining from Malaysia, so hi.
Oh wow,
international
hi.
Today. And hi Lorraine and Lindsay as well, and Terry. Gosh, lots of people joining, so thanks for getting involved. It's brilliant. So a good example as well, I suppose, sort of leading on from what you're just explaining, Claire, sort of is that I use a walking stick quite often when I'm out and about.
I was going to ask how you use your mobility aids.
Yeah, and I found they've been really good because I get a lot of low back and pelvis and hip pain, and the pain actually was getting to a point where then I couldn't be as active because it would just keep flaring it up, and it meant I was getting out and about less, particularly to places where you don't have seats sort of readily available. So like going out for countryside walks, around museums, things like that. So I found that sticks have been really helpful because I've been able to use them to get out and about more, and it's helped reduce the pain I experience when I am active, meaning I can actually do more. And particularly going to those places where there aren't seats readily available, I've invested in a stick that folds out into a seat, so then I can get out and about and take a rest whenever I need to. So it's been really helpful in kind of opening up more opportunities and helping me be active, which then helps my AS as well.
Yeah, absolutely. Some really good examples. Did you find it difficult to make the decision to start using mobility aids though then, Zoe?
Absolutely, yeah. I think
I
I
bet.
think a lot of people I've spoken to have found this as well. They sort of think, well, I don't want to do it too soon if I don't need to, but I also don't want to let things progress. And if I left it too late, then I would have been less active, so my muscles would have been weaker, and you get into that negative cycle then. So it was tricky in a way finding when was the right time. I actually found it helpful talking to my friend who has AS, and he uses a stick as well. And he used this analogy of using a dishwasher, where he said, if using a dishwasher saves you time and energy, and less pain, why we wouldn't think twice about using a dishwasher. So when I was then talking about mobility aids, it was like, well, why do you feel apprehensive about that? It's just another thing that's going
Mm.
to save you that pain, that fatigue. So that was a really good way of looking at it.
Yeah, I think that's a really a good way of kind of making peace with it in your head, isn't there? Because I should imagine there's quite an emotional impact of using a mobility aid, positive and negative, and depending on your age, would you say, or there is
Yeah,
stigma
absolutely.
attached to it to a degree, or
Yeah, as a sort of younger, I wouldn't say young person, there's definitely that sort of worry of having that outward sign of having a disability, or being disabled. So yeah, it was tricky making that first step.
mm,
But I think it was then when I was thinking about, I have other things in my toolkit that really help my condition. Um, Although there's kind of less outwardly obvious, it was just trying to reframe it and think of a mobility aid as, again, it's just another thing in your toolkit, and helping you manage your condition and be active. And if something's going to have that positive impact, you've just got to understand that it doesn't matter if people say or think other things when they see you with them.
yeah, absolutely. I love the reference to the toolkit because I think that's the beauty of the toolkit, isn't it? It's about using the things that you've got available to you when you feel you need them as an individual, and you're all so beautifully different as patients. That's what makes it such a delight to work with you all. But we do know that you are all individual, and you may all need different things at different times. I think for me, one of the really important messages as well to get across to our viewers or anybody that's going to watch this later, is just because you have a diagnosis of Axial SpA, it doesn't mean that you necessarily will need to use a mobility aid of any sort. But also, it's just to be aware that there are things there that can help you along your journey at different times with your mobility. And it goes back to being able to give you the tools as healthcare professionals as well to actually live an independent life and a normal life, because that's what you want, is what we want for you. And mobility aids is just one of those amazing bits in your toolkit, as you say. Yeah.
Absolutely, yeah, it's definitely not an inevitability for someone, and for me, even though I use one now, I know that in the future I may not need to as well. So it's understanding, as you say, it's just one of those tools. Yeah,
Yeah.
from a healthcare professional perspective, do you have any advice on how people can decide kind of when is the best time to use one?
I think, it is really tricky, as I say, because it is a very individual thing. And remember, it will vary from time to time, but maybe, as an individual, is be led by your symptoms. We always tend to guide you to listen to your body, listen to what symptoms you have and what that means for you and what you're going to do that day, or what you're going to do that week. So maybe have a think, is your pain a little bit worse? Is your fatigue a little bit worse? Will that help support what you need to achieve during that day or during that week? Maybe look at what you may consider a slightly worse day for you. And then, you know, if you wake up and you think, actually, this isn't a brilliant day for me, do you use a mobility aid on those days, for example? The other thing as well is think about what activity you're going to do that day. If you're going to go to a location or do something that is going to involve a little bit more walking for you, maybe they're the good days to use it. Or indeed, if you're going to go to a location and you might be having a bit of a flare or something like that, is it something you would take with you if you know the area is going to be busy? Because actually it's a bit of a, oh, hello, this person might need a little bit more space. They've got a mobility aid, so I'll just give them a little bit more room. And it perhaps gives you that support in that context as well if you're going to a busy venue or a busy event. So it is very individual though, but my top advice would be listen to your body.
That's brilliant. That's really helpful advice. Thank you. And I know when I spoke to Gillian, you know Gillian well, we spoke about mobility aids, and she uses a scooter. And she said part of the reason was it's been really good to get that where people then give you a bit more space, not necessarily rushing you, and that can be really helpful.
Yeah, absolutely. And I know, as you say, I know Gillian very well. So hello to her if she's watching. You know, I know Gillian goes absolutely anywhere and everywhere on her scooter. And it just gives her that amazing freedom that she wants, which is fantastic. So.
Absolutely. That's brilliant. So I can see we've got lots of people joining us live. Okay, that's good. Someone had a problem with their sound, but it looks like it's solved now, so that's great. Brilliant. So I think then, shall I hand over to you for your presentation now? We can come back and answer anyone's questions at the end. I can see Helen's popped one in there in the comments. That's great. I'll make sure that we answer that towards the end of the session.
Okay, lovely. So I'll try and share my slides. So just bear with me. And Zoe, you'll tell me
when I can see those. Yeah. So I'll make sure everyone can see you as well. Yep, that's all ready to go. So I'll come back once you've finished the presentation, and we'll have a chat then as well. Thank you.
Thank you. So as Zoe said, we're hoping just to give you an overview of different mobility aids that we use for patients with Axial SpA or generally. Zoe, before you disappear too far, I'm just having a problem moving on with my slide at the moment. Can you just confirm whether it's moved on at your end?
It hasn't at the moment.
Okay, let me just stop the sharing. Sorry, everybody. Let's have another go.
That's okay.
Let's try do it from here. Just confirm for me now what you can see, Zoe.
I can see the first slide at the moment.
And if I move,
perfect.
Lovely. That's better then. That's good. And I'm just going to move myself, so bear with me. Otherwise, I'm in the middle of the slide. Yeah, so sorry about that. So just to confirm, I'm just hopefully going to give you an oversight of what different mobility aids that we may use and that we may see, both from what we may be able to provide for you in the NHS, but what you may look at privately as well. And this is just to really confirm what we use mobility aids for generally, as I mentioned earlier, that we use them for patients or people who are recovering from injuries or surgeries or accidents where we need to reduce your weight bearing a little bit on a particular joint, for example, or limb. But we use them a lot as well, and within Axial SpA for patients who have reduced balance, who may be at risk of falling, for example, who may have loss of muscle power in their lower limbs for various reasons, or problems with walking generally. And we also use them, as you can see here, for patients who may be in pain or have weakness or instability, and we want to offload the lower limbs, as I say. But we use this across many different illnesses and disease groups and injuries. So when we think about basic walking aids, the first thing that I'm hoping would come to people's mind is what we call walking sticks. Some people refer to them as canes, but we tend to call them walking sticks in the UK. And you can see here, and as you know, they come in lots of different varieties, and the two distinct differences obviously will be whether you have a stick that is a wooden stick or a metal stick, and some of it can be personal preference. I have some patients who really like the look of a wooden stick. I have others that prefer metal sticks because they think it looks a bit better or a bit different. In terms of prescription, or what you might like to select, is we know that wooden sticks, for example, tend to last a bit longer. Potentially, the metal sticks can be prone to corroding potentially in the future. The thing with a wooden stick as well, you can actually adjust it to your perfect height, and we're going to talk about that and how you measure a stick in the next few minutes. But with a wooden stick, you can actually cut it to the exact height that you need, obviously, although that's not to say that you can't adjust a metal stick either, because they tend to have holes where you can adjust the tubing to get a fairly good height for you, and the correct height for you. People might select the metal sticks as well, because you can get foldable ones if you're purchasing them yourself. And the metal sticks in general tend to be slightly lighter weight. Some people find them therefore a bit easier to use. The thing with either of these sticks, whether they're wooden or metal, is that it does mean that you can put a reasonable or have a reasonable amount of pressure or weight going through your hand. So if you're somebody with axial SpA and you have what we call peripheral joint symptoms, so things affecting your fingers or your wrists, for example, then sometimes the grip on a normal stick can be quite uncomfortable. And so we'll have a look at an alternative version that may be suitable for you on the next slide. So we use these sticks, whether it's wooden or metal, mainly to aid your balance. And they take a little bit less weight than what we call elbow crutches, which I'll talk to you about in a few moments. Now, if you're purchasing a stick privately, then some of them do come with wrist straps to make sure that their stick doesn't drop to the floor, for example. As a physiotherapist, I'm just warning you to be slightly careful with them when you're actually out and about and using them, or when you're going to sit down. But as you can see in this photo with our lovely Zoe, the wrist straps can be quite handy if you're holding on to 2 ice cream cones that you're going to eat. Zoe reassures me that she wasn't going to eat both of these, she was just holding them for somebody else. So the straps can be a bit of a problem sometimes, so just be aware of them, but other times they can be useful as well. The next stick that we have a slight variation on, and we tend to see these more with the metal sticks, is what we call a quad stick. So as you can see from the picture here, it literally means that it's got 4 feet to it rather than just the 1 foot. The quad sticks are a little bit more cumbersome to use, and you tend to end up walking at a much slower walking speed if you have a quad stick, just because it's more of a definite placement onto the floor. But we use them if you need a little bit more extra help with your balance. But that may be something that you could look at as well, is a quad stick. This variation to the stick is the handle placement that I was perhaps alluding to before. If you do have some peripheral joint problems with your condition, and you can't take the weight through your hand as much with a normal stick that we just looked at, we can give you, or you could look at buying a stick that's got what we call a Fisher handle. So it's a molded handle that allows your palm of your hand to sit onto the handle a little bit more directly, and it distributes the weight through the palm of the hand rather than just through the grip of the hand. So I use these fairly frequently when I'm in clinic, because it just seems to be much more comfortable for patients who have arthritis, whether that be rheumatoid arthritis, for example, or axial SpA. So we use that quite a lot in my clinical practice. As I've mentioned before, You can also, with the metal sticks, get folding sticks. So we don't tend to provide these through our NHS services. So it would be something that you could look at purchasing privately if you wanted to. Again, they come with Fisher handles or normal handles, depending on what you prefer, with straps, without straps. They also come with the 1 foot, or you can get a slight modified one where it would be classed as a folding quad stick that gives you just a slightly larger base of support at the bottom. So they're available to you as well. My only feedback from my patients with these are, if you again have peripheral joint involvement, then they can be a little bit fiddly to kind of pull together. Some patients find them really easy to do because they tend to be elasticated. You pull them out and then the tubing slots in, but it's just perhaps to be a little bit wary of it. And just as a caution, make sure that the tubing is slotted in correctly and clicks in as it should do. As per the manufacturer's guidelines, you should get a leaflet with it that shows you how to put it together correctly and safely. So that would be my only other top tip with a folding stick. The next thing you could look at, and again, we don't provide these in the NHS, so it would be a private provision, is a folding stick that has a seat with it. So please be mindful they come in different varieties. There's lots of these on the private market. So really have a look and make sure that you're purchasing a good variety or one that's going to be suitable for you. A lot of them are literally for you to perch on, but I think as Zoe just alluded to, they can be really good if you're going out for a longer walk and you're not quite sure when there's going to be an opportunity for you to rest on a chair or have a rest on a wall or something like that. So some people find these really useful if they're going to an event that's going to be an all-day event, for example, and you just want the flexibility of offloading your lower limbs slightly, then that may be a good option for you. Just be wary, obviously, that when you're using them on a flat surface, and just be mindful that you're going to be safe with them. And not lift your feet, for example, because most of them tend to be single stem. Now, when we're looking at actually how to measure a stick, when we're measuring you in physiotherapy practice, it's really important that we get the right height for you. What we don't want is your stick to be too tall that it makes you hunch your shoulder, because it could give you secondary shoulder pain or change your posture at your spine. Similarly, we don't want it too short either, because that will encourage you to flex forward potentially, and also alter your posture or alter your alignment of your hip, for example, which in turn can then actually reduce your ability to walk nicely. So when we measure you, we tend to get you to stand with your shoes on, and I'm giving you this guidance in case you purchase a stick privately. So we tend to measure you with your normal shoes on, and we get you to rest your arm by your side and then just bend your elbow very slightly to 10 or 15 degrees, as you can see in this picture. And then we literally get you to rest the stick by the side of your foot. And if you have a look on your wrist, as you can see in the picture, let me just take that off, you can feel that you've got two bony points at your wrist. And this is where we measure the top of the stick to. So feet roughly hip distance apart, okay, so nice normal standing position, shoes on, elbows slightly bent, and then the top of the stick, when your arm is resting at your side in that bent position, should come to that bony point at your wrist there. And that's the height that your stick should be, and that should be the correct height for you generally. Now, sometimes we have slight variation depending on our patients and what their needs are, but as a general rule of thumb, that's how you should measure to make sure that you've got the right stick, whether it be a metal one, whether it be a wooden one, whether it be an elbow crutch, which we're just about to look at in a moment. That measuring system is universal across most sticks. Now, the other question I get asked a lot of is, which hand should I hold my stick in? And again, there is a general rule of thumb, but I appreciate not everybody fits a textbook, and so it may be individual for you. But when we think about which hand you should have your stick in if you're just using one stick, we think about what our normal walking pattern is. And when we walk, we swing naturally opposite arm and leg. And so we want to try and mimic as much normal walking pattern as we can when we're using a walking aid as well. So the general rule is that you should hold your stick stick in the opposite hand to your affected side. Okay, so if, for example, you had less muscle power or less range of movement in your right leg, you would use your stick in your left hand. Okay, as you put your right foot forward, your left arm will naturally swing forward, and therefore the stick will naturally place to the floor, and it will give you a really nice wide base of support, or encourage a wider base of support, which will help your balance. If you have pain on that right leg as well, it will just naturally put some of your weight through to that left side and will offload your affected or painful right side. So as a general rule, as I say, you hold the stick in the opposite hand to your affected side, however affected that side is, whether it be pain or weakness. A really important tip when you're walking with a stick: don't place your stick too far in front of you, okay, or too far out to the side, because actually it may just push you over that balance point and actually make you feel more unbalanced. So it should just sit slightly out to the side of your body, okay, and slightly in front of you as you walk. And it can take some time to practice with a stick and make it part of your normal pattern. So just give yourself a good few days to practice with it, and you may want to practice at home in a safe environment. The other thing, my top tip, is your walking stick isn't a fashion accessory. See lots of people who kind of wave it around in the air or move obstacles out of the way as they're walking. If you do that, again, it encourages you to perhaps work outside or move outside of your base of support of balance, and can make you a little bit more unbalanced and more at risk of falling. So just use it as it's intended, rather than as a fashion accessory. The next walking aid that we may progress somebody to, or that may be suitable for you, is what we classically known as elbow crutches, and you see these, everywhere for different reasons that we're using them with patients. With these, you're able just to put a bit more weight through them. So if you're unable to weight bear so much through your legs, then it may be that we progress you to an elbow crutch, just to give you that bit more support. Now, for any of you that have used these, again, because you're putting more weight through your arms to offload your legs, and that's the purpose of these elbow crutches, it can cause you a little bit of discomfort in your hand, particularly with the grip of a normal elbow crutch. So you can purchase online hand cushions that you wrap around the handle of the elbow crutch, and it's just like a foam or a material that tries to make it more comfortable to use these elbow crutches. The other thing as well, we can get these as Fisher sticks. So that splayed handle that I spoke to you about earlier, that just allows you to distribute the weight through the palm of the hand a bit more. So that may be an option for you as well. The only thing that I haven't put on here, and just in case it comes up in comment, is what we call armpit sticks or axilla crutches. So they're the crutches that you see that sit right into somebody's armpits. We don't tend to use those a lot in the UK for various reasons. And I can't think of any time in my clinical practice when I've needed to or wanted to use these with a patient with AS. So if it is something that you're concerned about or want to know a bit more about, then please contact Zoe on the helpline, and she can get a message to me, and I can discuss through with you the pros and cons of using axilla crutches. The next progression we may make, or that may be an option for you, is what we call a gutter crutch. So as you can see from the pictures here, these look a little bit like the elbow crutches that we use. But as you can see, there's what we call a gutter or a gully, where you would place your forearm on top of the stick and use the stick in that way to aid your balance. Now, gutter crutches I've used for a few patients, and we use them a lot if you do have a lot of arthritis in your hand, or if you have involvement with shoulder pain, for example, or if your posture is altered where you can't use the other options of sticks that I've already showed you today. With these gutter crutches, you distribute the weight even more out of the hand and into the forearm. So for some people, they're a lot more tolerable. The only downside with these is they're quite cumbersome. So some of the patient feedback is that it limits their function quite a lot when they're using them, because you do need the forearm strap to actually keep the device in place. So I've got a few patients that I've used this with quite effectively, but they are very aware that it limits their function in other ways. But to actually keep them mobile when they're going out walking, they find them, really easy to use and much better to use rather than the normal grip or even the Fisher stick grip that we see. So just a few safety points on those sticks that we've looked at, or those walking sticks that we've looked at now, is just really make sure that you are checking any of your walking aids to make sure that they're not bent or damaged, for example, with wooden sticks, just to make sure that there's no cracks in the stem of the wood that might mean the integrity is going and therefore that you need to replace it. Make sure with the metal sticks, particularly if they're folding sticks, that there's no cracks at the join that can develop over time. So just spend a bit of time every now and then just inspecting your walking aids, making sure that they're fit for purpose still. With your walking stick and crutches as well, if they're metal ones, as I say, you can adjust them. You can slide the tubes in and out of each other, and there's small holes in them with clips in them that will allow you to adjust the height and then hold that height. Sometimes there's a metal clip that goes inside and will clip out of the two holes as you adjust the height, and it's going to stay there. Other times you have what we call this horseshoe clip, as you can see in the picture here, that you take out, you adjust the height, and then you put the pin back through the two holes, and that will hold the stick at the length that you require. So in either of these cases, just make sure either of the pins are poking out each end, because then it's in the right place, or just make sure that the horse clip isn't loose or worn out as well, because that's going to hold the two tubes at the length that you want. And then when you're walking around at home, it's just make sure if you're using your stick that you don't have things such as mats or rugs that may actually just catch the stick as you lift it, for example. Just a nice little top tip for you. And also, obviously, just be aware when you're using sticks of wet floors or uneven surfaces, or piles of leaves, for example, on the side of your pathway that are wet, because all of that can be slippery. And we're going to talk about ferrules in a moment, but that's the only downside with using walking aids, is you do have to be a bit careful about the surface that you're using them on, and make sure that you're safe when you're using them. The other one I see sometimes is people loading up carrier bags on their elbow crutches, for example. Just remember that will change the distribution of your weight, and your body's going to have to adjust to that weight if you've got bags of shopping that you're carrying with your stick. So just be a bit cautious of that. And hopefully you won't have any accidents or falls, but if you do, just remember to just go back and do those checks for me to make sure your sticks are still good, and that you don't need to replace them. The other thing I get asked about is how to use the stick when you're going up and down stairs, and this can be really important. There is a general rule of thumb, and it's perhaps a saying that I was taught many years ago when I was trained, and I hope not to offend anybody with the wording that we're using here, but it is just a general rule of thumb and a good guide for you. And the first thing is to make sure you use a handrail if you've got one, and the second thing is to make sure you just do one step at a time if you need to. Okay, and the general rule is when you're going upstairs, you should always lead with your good leg. Okay, so it's your good leg going to heaven. Okay, and you would go good leg first, then your bad leg, and then the stick. And then when you're coming downstairs, you would do the opposite. So we suggest that it's bad leg going to hell. So you would go down with your bad leg first, or your affected leg, whether it be the more painful one or the weaker one. So you would place your stick, then your bad leg, so it can help take the weight, and then your good leg would follow. Okay, so the general rule of thumb: upstairs, good leg to heaven; coming downstairs, bad leg to hell. Now I've put a big arrow and a question mark on this photo, because you will recall in the last slide, I said to you that you should hold the stick in the opposite hand to your affected leg. Well, obviously it depends where your handrail is as to whether you can do that or not. So I'm just perhaps pointing out on the picture that I am aware that the stick is on the same side as the affected leg. The next thing to think about are the rubber parts on the end of your sticks. These are called ferrules. These are really important, okay? They are the things that stop your stick slipping on a wet surface or a slippery surface. And you really need to make sure that you check these regularly, okay? So the bottoms of the ferrules will either have indented circles or little bobbly bits or hash lines, as you can see on the example here. And you need to think about these ferrules similar to the tyres that we have on our cars and the treads that we have on the tyres. It's really important that we have treads to distribute the water or slippiness on the surface that we may be walking on, and we wouldn't drive our cars with slick tyres. So similarly, you don't want to have slick ferrules. It's really important that you check them, make sure that the grooves or the bobbles are there, and if they're not, then replace them with new ferrules. So in my clinical practice, I have a little stash of ferrules, so I constantly check people's walking aids when they come in, and I replace them. But you can purchase these in hardware stores or in chemists sometimes, or you can buy them online as well. So it's always worth just having a few spares, and just check your ferrules every now and then, and they run down a little bit quicker than perhaps we might think they do. So make sure you check them regularly. The other thing to just cover is about when you go to sit down. This is really, really important as well. When you go to sit down in a chair, when you're using a walking aid, make sure that you reverse up, as it were, so you can feel the chair behind your legs, okay? And you should place the stick to the side of your chair before you reach down to use the arms of the chair with your own hands to then sit down, okay? You shouldn't hold on to the stick and use that before you lower yourself down. Make sure you're using your arms and using the arms of the chair to lower yourself down. And really importantly, if you're using an elbow crutch, make sure that your whole arm is out of the cuff of the arm, for example, or out of the strap if you've got a stick. So as I say, place the stick or the elbow crutch to the side of you before you then go to sit down. When you're standing up, again, you want to do the reverse. So make sure you have your walking aid close to you, obviously, but use the arms of the chair, use the power in your legs to actually push up rather than trying to weight bear and push through your walking aid or your stick. It's not stable, and it may actually lead you to be unbalanced. The next thing we might use, but I have to say I haven't used these very frequently at all with my patient group who have AS, are walking frames, or what we call Zimmer frames, as you can see in the picture here. Some patients like these because you can attach a bag, as you can see, and you can carry stuff around a bit easier. So we use these if you have reduced balance again and you can't tolerate using a walking stick or an elbow crutch. Again, this is something that you need to make sure that you've got the right height for, so you're not raising your shoulders too high or flexing forward too much. You can get some of these with two wheels at the front, which enable you to push it along rather than having to lift it and place it so much. So if you would struggle to lift the frame, even though it's metal and fairly lightweight, we do have some patients who struggle with that, and so they use the wheels to help push it along. The really important one, a bit like the stick, is if you're using this, don't push the frame too far ahead of you, because you will just end up reaching forward and potentially overbalance. Okay, so it's just a small push forward and then step into the frame area to aid your balance. So the next one, we see quite a few patients who opt to purchase these privately, as well as what we call rolling walkers or delta rollators, or just rollators we refer them to. The beauty of some of these, they tend to have 4 wheels, or they're triangular and have 3 wheels. And the beauty of these is they tend to have a bit of storage with them, importantly. They're easy to push along. And also, as you can see in the picture here, some of them have seats, so you can use them when you're out and about, and you know you can always take a rest if you need to. Some of them have brakes on, some of them don't. So I haven't issued any of these generally for my AS patients, but I know quite a few of them have purchased these privately, just to give them the flexibility to get out and about, a bit like we said with Zoe earlier. Now, in terms of scooters or wheelchairs or trikes, this is a very specialised area, and I have some amazing colleagues who work with wheelchair services within the NHS. So I don't tend to prescribe these at all. And I'm very aware that there's a huge market of these privately as well. So this is an area that I would refer to my wiser colleagues on. And I know at Members' Day recently, we had a gentleman who very proudly showed us his electric wheelchair that he had purchased himself, and how agile it was, and how it had transformed his life to enable him to get out and about. So it may be something that you want to consider. Within NHS services, as I say, we have wheelchair specialists who we would refer you to if it was appropriate to do that. If you are thinking of a mobility aid, and I think, as Zoe mentioned, really, there doesn't need to be a stigma attached to this, and things are changing drastically with the look of mobility aids. We obviously have a limited resource of what we can fund and provide for you in the NHS, but privately, there are lots of different resources out there. Just really make sure you're going to a good manufacturer and that you're really looking at the equipment and the quality of the equipment. But there are lots of different things you can look at, different coloured walking sticks, for example, to suit different outfits if you want to. The folding sticks, as I say, come in lots of different variety of colours as well, and floral patterns or geometric patterns. Really depends what takes your fancy. Even the ferrules these days are coming in different colours and designs, rather than what I call the NHS grey ferrule that we have that we can provide for you. You can buy ferrules that are blinged up with diamantes, or you can bling them up yourself. And I did exactly that for my mum for a wedding recently, in bright print crystal. So it depends what you fancy, but you can make it yourself or have one done for you. I even found for this presentation a walking stick that lights up if you want it to. And then, as you can see in the middle of the picture, one of our amazing patients who lives, I think it's in Canada, and her story's on the NASS website, called Steph. She has a rollator, as you can see, amongst other walking aids, and she spray painted hers pink because she likes the colour pink and just wanted something a bit different. So there are lots of different resources out there. One of the other questions I get asked is about whether you can bring your walking aids back to us in the NHS, and it really depends on your local facility. Some areas, sometimes you're allowed to bring walking aids back, but we do have an issue, obviously, in NHS about making sure we can meet infection control standards before we reissue them, and also safety standards. So I would really check with your local area if you've got walking aids that you would like to take back. Just check your local physio department or local hospital to see whether they are receiving them or not. So who can advise you about mobility aids? Well, we've got lots of information on the NASS website, obviously, and in our AS newsletter that you can look at. Physiotherapists can potentially prescribe walking aids for you, occupational therapists, other healthcare professionals. We've put GP on there. Obviously, I can't advocate that you might book an appointment with your GP just for a walking aid. I'd prefer you, I think, to self-refer to physiotherapy because we're more likely to be able to do that for you rather than take a GP appointment to do that. But nonetheless, if you're at your GP practice and it's something you could bring up while you're there for something else, they can always refer you or guide you on who can actually see you for that walking aid. My only other thing as well is it really does vary from service to service and locality to locality, certainly in the UK, as to what funding and what equipment services are able to give you. So just be open to the fact that what you might be able to get from your local service, but certainly engage and have that conversation with them. There's just a few sites that you might want to look at. There's lots of providers, obviously, online for mobility aids that you can purchase privately, and there's just a few here. And when I was prepping for this presentation, I noticed that Which had done a review late last year, I think it was October 2022, looking at different walking aids and Zimmer frames, and rollators. So you might want to have a look at that Which article. They make the point, though, that they haven't tested all of the equipment that they discuss, but they do discuss it quite in depth, which is good. The other thing I wanted to allude to was just about Nordic walking. I don't know whether people are aware of this, but there are Nordic walking poles that you can get. I use this with lots of my patients, and lots of my patients have undertaken Nordic walking or have the poles. And this is a form of exercise that indeed you may just want to think about, which would be fantastic for your condition. Please be mindful these poles are not weight-bearing poles though, but what they do is they work your body in a biomechanical way and encourage normal movement that we know can help musculoskeletal back pain, for example, and uses 90% of your musculoskeletal system. So they're not weight-bearing, but it is an exercise that we do encourage for Axial SpA patients if it's of interest for you. The other thing I just want to draw your attention to related to all of this regarding balance and strength and range of movement, for example, is please don't forget your exercises. Please don't just rely on walking aids. Okay, maintaining good lower limb strength, core stability, posture and balance is something that's really important for all of our AS patients. I'd refer you also to the Royal Osteoporosis Society webpage. They've got some amazing exercise videos on there for people who have reduced balance, for example. And so these exercises are really safe for AS patients as well. So you may want to look at that as a resource. The Chartered Society of Physiotherapy, obviously, as well, have produced strength and balance exercise programs, and you can find that on their website page as per the details here under the Get Up and Go campaign. And again, these are exercises that are well researched and really safe for AS patients to perform as well. Of course, we have the fantastic library of past Facebook Live sessions looking at exercise as well. So do make sure that you have a look on the website page at all of the exercise videos that are there. There are some specific ones about strength and balance as well that you might want to have a look at that can encourage you along and support you. And then lastly, but certainly not least, please have a look at the stories that we have at NASS. There's one from Gillian and Stefan Zoe herself about using mobility aids and how it's transformed their life and also supported them to live with their AS. So don't take it from me, take it from your fellow AS patients and colleagues and friends. So thank you for listening. I'm sure I've gone well over time, but I hope you found it informative.
That was fantastic. Thank you so much. And a really comprehensive overview of everything. So thank you. It's going to be really helpful, I think, for people so even watching on catch up to get that info. I just realised that my video has frozen. There we go. Good old technology. That's fantastic. And thank you to everyone who has been sharing your experiences and asking your questions in the comments. We do have time for a short Q&A. So and one thing I think would be good to mention from people sharing their experiences, Lorraine said that she has AS and fibromyalgia and she is 62 and she found her scooter really helpful to go shopping and then carry the shopping home afterwards. That's really good to hear.
Yeah, fantastic. And I think that's quite right. If you need to use a mobility aid to help you kind of function in life, then great, go for it. And then what it will hopefully do is allow you then to have the time to do other nice stuff as well that you want to do, that you want to have the energy to do, and even allow you the time to do those exercises that the naggy physio keeps on reminding you about as well. So it is about prioritizing, isn't it? And allowing yourself the ability to then do other stuff as well.
Absolutely. Yeah, it's really important, isn't it? And yeah, I don't want to use all my energy up on the shopping and then not be able to do the stuff either that I want to do or that I have to do to keep my
absolutely
under control. Brilliant. So I mean, we had one question from Helen, which you sort of covered towards the end there, but it would be good just to clarify. Helen asked if she should speak to her rheumatology team or to the physiotherapy team. I imagine it depends on area, but if you just clarify.
Yeah, absolutely. So, I mean, I have the pleasure of working with an amazing rheumatology team and the nurse specialists and healthcare support workers, and some of them are able to actually issue walking aids themselves because we've done training to measure it correctly, etc., or check ferrules, things like that. So it really does depend on your unit. If you've got a patient, if you're registered with your rheumatology department and they've got a patient advice line, you could start there first because they can do a quick call back to you and say, actually, that's not us, but we can, you know, refer you to your physiotherapy department, or actually, you know, you need to log a referral with your physio department, or whoever it is the provider in that area. So start there. If not, have a look as well at your online. A lot of musculoskeletal services, physio services have self-referral now. I personally would rather see a patient as a one-off assessment on a referral to discuss mobility aids if you felt you needed one, and what the most suitable thing was for you, if indeed it is suitable for you. I'd rather do that as a one-off and discharge you, rather than you struggle on and perhaps end up coming into our service for a different reason, because actually you've had a fall, or, you know, you've got a lot worse, for example. So don't be afraid to have that one-off conversation. Even if it is an assessment, as I say, a mobility aid advice and then discharge, that's still beneficial in my mind. That's really helpful, thank you. And not strictly mobility aids, but I'm hoping I'm not being too cheeky in asking. Janet asked about any advice on being able to get out of bed, any aids that would help with that. Okay, so one of the biggest things that you can do to get out of bed more easily is make sure that you're using the momentum of your own body. Lots of people try to sit bolt upright in bed. And that can be really hard on anybody. It really can strain your back quite a lot, even if you don't have AS. So make sure that you roll onto your side, okay? And use your top leg and your bottom leg over the side of the bed to give you that lever to then push up on your arms to come up into sitting, rather than trying to go bolt upright. On the NASS website, there is, in the 2-minute exercise videos, there is one on there. Zoe, maybe you could find it later and put it on the chat or send it out. There's a video that shows you that exact maneuver to help people, particularly if you're feeling really stiff in the morning. And also a little exercise to prepare your body to wake it up a bit, ready for that maneuver. If that still isn't working for you, then it would be a referral through to my occupational therapy colleagues, because they have some amazing gadgets that they can attach to your bed or encourage you with to help you get out of bed. So I would seek a referral to occupational therapy as well. That's brilliant, thank you. And yeah, I'll pop the link to the video in the chat afterwards. Yeah, there's small like metal frames, for example, that you can get wedged under a mattress and it helps you pull yourself up, for example. But I would try and use your own body's momentum first, because if nothing else, it's good exercise. It encourages you to do that kind of stuff, and we want your body to be able to do it. Yeah, good to get those exercises in first thing as well. Yeah. That's brilliant, thank you. So any other questions, please do pop them in the chat. And if you are watching on catch up, then please do pop your questions in, and I'll keep an eye out. And Claire, if you're happy, I'll pass them on to you. Absolutely. If you have any. Yeah. Brilliant. Absolutely. So while I give people just a couple of minutes to ask any more burning questions, I thought I'd just show you a couple of my sticks. Now, my one that folds out into a seat, I forgot I have got it in the boot of my car, so I haven't got that. But I started off with a very simple looking kind of folding stick, because it's really lightweight and I could just put it in a bag, and then if I needed it while I was out, I could use it. And then you can see the progression of my confidence with mobility aids, because I go from this to something a little bit more interesting. Nice. I've got an event to go to, and I thought, oh, I'll have something jazzy. And then finally, interestingly, it's worth experimenting with different handles as well, because I then got this one, which I find the most comfortable on my hands. So, oh, that's good. Whole range out there. Yeah, really good. I like it. Accessorize different outfits, Zoe. Very good. Absolutely. I had I was shopping in my local shopping centre the week after Christmas, and there was a young lady walking around, and she had wrapped tinsel up her stick, and it just looked so lovely. It was really, really nice. That was good. That's my plan for next year. Yeah, it was very nice. I told her so as well, because I just thought, I did say to her, I really like your stick. So it's nice. It's like if someone compliments your outfit or something, isn't it? It's just, absolutely. That's exactly why I did it. Yeah. Yeah. Oh, lovely. Wonderful. So we haven't had any extra comments in, but please do keep adding them to the conversation after the live has finished.
If you join partway through, then the video will stay on our Facebook page and we'll also upload it onto YouTube as well. And just to let everyone know that the next session is going to be on Tuesday the 24th of January at 1 p.m. and I'll be joined by Professor Gareth Jones, who's going to be talking about the research into biologic therapy and hopefully answering your questions there as well. So wonderful. Before you finish up, is there anything else you wanted to add, Claire?
No, I think just remember you're all individuals. You're all going on the same journey, but in a different way at a different time. So, just do what's right for you and seek medical support if you need it. And just remember every day is a different day. So just listen to your body.
That is the perfect advice to end on. Well, thank you so much for your time and your expertise,
That's
Claire.
right. It's been a pleasure.
Fantastic.
Thank you. Thank you very much.
Thanks everyone for watching and joining in as well. Take care and see you all next time.